This chapter also contains the bulk of the suffixes and prefixes we will use throughout the semester. There will be other suffixes and prefixes we will add as we get into the various organ systems, but the bulk of what you're going to need to use is going to be here in this chapter. However, as many of them that they have listed here, there are still others that have to be added at this time, and you will see that in both my notes and in this presentation. Also, some of the definitions used by your textbook are not correct. And that's why I want you to use the definitions I've listed in my notes, as well as those here in those corrected suffixes and prefixes. Now, when we look at these suffixes and prefixes, understand we're not going to just learn them now and never use them again. You're going to be using them throughout the semester, and that is why I recommend that before every quiz or exam, go back over your note cards for these to refresh them. Some of these we will be using all the time, but others we won't be using right now. And then later on, you'll see them. And if you've got to relearn them, it's going to make it much more difficult. If you can just refresh every couple of weeks going through these, it's going to make it much easier throughout the semester. Now we're going to begin with some of what I call the trickier suffixes and prefixes. The first being the terms you see here. Now, all of these terms are listed here and in my notes as well as in your text, and you can see the definitions listed, but there is a word missing that must be included when you define these terms, and that word is surgical. When I look at an ectomy is an excision or a surgical removal. Now, when you use the suffix ectomy and you define it, you don't have to use both of these definitions. You use one or the other. You either say a surgical removal or an excision. Use one or the other. The reason you don't need to use both is because an excision is a surgical removal. Now, surgical removal, that term surgical implies that we're doing it aseptically in a very sterile environment, which is an operating theater, to prevent infection. Same thing with tomy. Tomy is an incision or a surgical cut. If I take a knife and I slash someone across their abdomen, I am not performing a laparotomy. Okay, and that would, if I do a laparotomy, that would imply I'm doing it in a surgical theater in a very aseptic manner to prevent infection. Once again, I don't need to use both of these definitions, just incision or surgical cut, because an incision is a surgical cut. Stomy is a surgical opening to form a mouth. Plasty is a surgical repair. Centesis is a surgical puncture. Desis is a surgical binding. Now, pexy is a little bit tricky because when you look at the definition fixation or fix, it implies the same as surgical repair, but it doesn't mean that. Here, the word fix is looking more at location, not at the actual activity of repairing damage that's been done. So when I look at pexy and I say surgical fixation, it's implying to surgically put it in the location it needs to be. Same thing with to surgically fix in place. The next three suffixes we're going to look at, graph, graphy, and gram, are very close to one another. You're going to see two of these are what we refer to as noun suffixes because they define as it being a person, place, or thing. And then one of these is more of an active suffix, as you'll see, defining the activity that's being performed. Now, the first one here, graph, is an instrument for recording. Now, a good example of this is a cardiograph. Now, when I look at a cardiograph, this would be an instrument for recording the heart. Graphy is the process of recording. So when I look at this process and I use the same combining from cardio, I get the term cardiography. Now, look how similar these are. Cardiography is the activity that I'm undergoing. I am doing the process of recording the heart. To do that, I need an instrument, and that instrument is the cardiograph. Now, the result of using that instrument is a cardiogram. Now, this one is very tricky because when you see this, it's defined as record. Now, not record. Now, you'll notice when I say it, you can hear the difference between the two. Record is an activity. Now, that's the process of recording. But if I say record, now it implies the result of that process. So that's why one of the things I recommend is that instead of just saying record, define it as record of. So when I look at the term cardiogram, it means a record of the heart. So if I include of in my definition for gram, Now it makes it easier for me to see it, because too many students will put the word to in front of it, and once you say to record, now you're defining it as graphing. Now again, looking at these three terms, you can see how closely they are to one another. Each one uses the same combining form, but once I add a different suffix, it changes everything. And that's why in medical terminology, the suffix is the key component. Next, we're going to look at two suffixes, ia and osis. And again, very closely related, and these get confused by students all the time. Ia means condition. When I look at osis, it also says condition, but now I have to add a single word, and that word is abnormal, and it makes it totally different. Not all conditions are abnormal. Some are perfectly normal in the body, and these two will be separated by that simple word abnormal. Good example of which we're going to see later on in the word hydria, which means condition of sweating, and hidrosis, which means an abnormal condition of sweating. There's a big difference between the two. If I am working out, then I am undergoing the normal condition. If I am a diabetic and I'm in a cold room and I start sweating, then I know something is wrong. Meter and metry are very similar to what we saw with graph and graphy. Meter is an instrument for measuring. A good example of this is a spirometer. Now, if anybody's ever undergone surgery, this is a little device they give you when you're finished. You blow into it and you have to keep the little ball above a certain line, and that's to make sure that your lungs are working effectively. Now, when we use that device, we undergo the process of measuring. That's what metry is, and the term would be spirometry. So here, that's the process, and I would use the instrument to do so. Now you notice that here it's measuring, not recording. These are not the same thing. So you've got to keep in mind that words matter in this class a lot. We have to define them exactly as they are to be. Next, I'm going to see the suffix oma, and this one is so tricky that I'm going to be giving you a discussion question on it. Now with oma, this can be defined as mass, tumor, or collection. Now folks, when you see that word or, often what it's telling you is that these are not the same. Now that was not the case earlier when we said excision or surgical removal for the suffix ectomy. We just said you use one or the other, not both. Well, here, that's what this is implying. You have to use one or the other, not any of these three, because they do not mean the same thing. A mass is not a tumor, and a mass is not a collection. A tumor is not a mass. A tumor is not a collection. A collection is not a mass. A collection is not a tumor. So we have to know how to define them correctly. Now we'll get into the trickier prefixes. You're going to see these are not nearly as difficult as the suffixes, but we still need to go back over them. Spelling is going to be a key here, as well as making sure that you have the correct definition memorized for the correct component. We'll begin with the two prefixes inter and intra. You'll see they are very similarly spelled, but inter means between, intra means within. These two definitions are not remotely the same, so it's imperative that we get them memorized correctly for each component. Next, we see the two prefixes anti and anti. Here's where spelling is essential. The only difference between these two is one letter, an E versus an I. However, when I use the E, anti means before or forward, or anti means against. Now, anti, before or forward, you see each definition separated by the conjunction or. That means we either define it as before or we define it as forward, but we don't use both. Before is looking at a time frame. Forward is looking more at a direction. So we've got to be very careful how we use these, and that's why they are not interchangeable. Anti meaning against. Anti can also mean occasionally opposite. Now I don't put that in here, neither does your book, and the reason for that is because the only time you're going to see anti being used as opposite is in regard to the musculoskeletal system, and that's something you'll see more in anatomy and physiology versus here. Next, we see the two very most difficult of all prefixes, hyper, hypo. They are complete opposites. Hyper is above or excessive. Hypo is below or deficient. Now, once again, you see that conjunction or. Above is looking at location. Below is looking at location. Excessive and deficient are referring to amounts. So we've got to use one definition of the other, but not both. Now, when I look at this idea of excessive and deficient, another issue that we have to take into account is that some books will define it as either more than normal or less than normal. We will not do that in here. You will never use those definitions. You will use either excessive or deficient. The reason is that a normal is a very difficult thing to define. What is normal for one person is not always normal for another. When I say excessive or deficient, that's implying something is wrong, either too much or too little. And we don't worry about the norm if that's the case. Now we see pair and peri. Once again, the only difference is one letter. So in medical terminology, you see why spelling is so important. If you change this by one letter, you change the meaning completely. Per means through, peri means surrounding. Again, these are not remotely the same. The last one I have listed here is showing you the prefix bi and the combining form bio. Now, when I look at these two, very similar in their spelling. Okay, bi means two, bio, the combining form, means life. So why is it so tricky? Well, let's take a look at this word bilateral. Now, when you look at this term, you could break it down and define it in such a way that you would get the term meaning pertaining to two sides. But what if I use the combining form? Could this mean pertaining to the side of life? That sounds like a reasonable definition. Well, the answer is no. Because if I was looking at a term that meant pertaining to the side of life, I have to remember that both bio and latero are combining forms. And as I learned in my chapter 1 rules, whenever I have two combining forms, I keep the combining vowel. So if I was looking to a term that would be defined as pertaining to the side of life, it would be the term bilateral. This slide is going to show you the corrections that need to be made in regard to the suffixes in your textbook in this chapter. Now, there are several here. Now, a few of these we've already covered, but there are others we have not. Now, you need to go through your note cards and make sure you're defining them as you see here on this slide. I will not accept any other definitions, so please make sure you do it. Also, you're going to see here as well, I try to give you some examples of things too to make a little more sense. First of all, you see iatric or iatrix, okay? Here you're seeing, I'm showing you both the singular as possible the plural for that one. Going down a little bit further, you see the suffix lysis, and it says breakdown or destruction, not to loosen. We don't use the word, the definition loosen for lysis. It just simply doesn't make sense. If I undergo a lysis, I am seeing something being broken down or destroyed. It's not being loosened. Look through these. If you have any questions, please let me know, but I'll expect all of these to be defined as you see here. Now we're going to get into some of the suffixes missing from this chapter. These are ones that we're going to need to use throughout the semester, so they need to be learned now. We'll have some additional suffixes and prefixes coming later on, but these are ones right now that need to be added to your list of note cards. You will see the definitions for these listed in both the outline for this chapter as well as here in the presentation. First is the suffix site. Site means cell, so we need to make sure that's added. And now whatever combining form we add to it, we will know what type of cell it is. Is it a hepatocyte, which means a liver cell, or is it an erythrocyte, meaning a red blood cell? So we need to know that suffix now. Emia means a blood condition. Now this is going to be a very important definition as we go. Please make sure you note that it's not just a condition, it has to be a blood condition. Genesis means producing or forming. Now these two words are not the same. Forming implies the idea that something is coming about. When I look at producing, something else is making it. So when we look at these two, they're not quite the same. Gen is a form of Genesis. This means a substance that produces. So you can see how closely related that is. Genic is what we call a combination suffix. We're going to take this idea of Genesis, this producing, and we're going to add ic, which is a suffix as it means pertaining to. Now, your book is going to give you a lot of these suffixes that are combined from two other terms. And when you see that, you don't break them apart. You keep them as one, as you see here with genic. And now when we define it, we kind of put the definitions together. So it means either pertaining to producing or produced by. Opsi is to view. When I look at phobia, this means fear of. Plasia means development or formation. Now, these two words look very similar, but they're not quite the same. When I'm looking at the idea of formation, that means something is being made in the body. Development is looking at how something progresses. Sclerosis means hardening. You got to be careful here, because when you look at this, this is once again a combination suffix. You're going to see the suffix osis, and you're going to see sclero, which means to harden. Now, when you put them together, it doesn't become an abnormal condition of hardening. We don't put that osis suffix with it, but the osis is implying to you that something irregular is going on. Stasis is stopping or controlling. Now, once again, these are not the same thing. If I stop something, I'm impeding it. It's going no further. If I'm controlling something, it may still be allowed to move, but I'm going to be regulating it. Therapy is a suffix that means treatment. Once again, the combining form I put with it will determine what type of treatment I'm giving. Trophy is development or nourishment. Now, we will use development 99% of the time. The only time we will ever use nourishment as the definition for trophy is in regard to the formation of tumors, and that's during someone that has cancer. So that's the only time we will use that. Otherwise, you define it as development. Os. This is a very tricky suffix because it can mean pertaining to occasionally, okay, but very, very rare. 99.9% of the time, it's going to mean full of. For example, when I look at the term glucose, gluco means sugar. So I define that as full of sugar, not pertaining to sugar. Now, I will use os as pertaining to, but the only time I've ever really seen it used is in the term comatose, which means pertaining to a coma. Okay, you wouldn't say full of a coma. That doesn't make sense. And that's one of the things I want you to keep in mind as you're going through all this. If something doesn't sound right, it's not. It has to sound right to be right. When I say pertaining to sugar, yeah, it might mean that, but it's not going to be sounding right as full of sugar. If I say pertaining to a coma, that sounds better than saying full of a coma. So if it doesn't sound right, it's not. Use that as your guide. Next is blast. Blast means immature or embryonic. Now these are very close, but not the same. When I use the term immature, it means it has not become its functional self. Embryonic is referring more to the time of life between the 2nd and 8 weeks. So when something's an embryo, it is immature, but that's a stage of life and it won't be there forever. Crine is the suffix that means to secrete. Okay, if I look at the term endocrine, it means to secrete within, and we'll be seeing that in a future chapter. Drome means to run. Fusion is a tricky one because it can mean to pour, which is what we use the bulk of the time, but occasionally it will mean to come together. Now again, to pour is what we're going to use most often. Lapse means to fall or to sag. Now, these are close to one another, but not the same. When something is sagging, you can say, yes, in essence, it's falling, but it doesn't mean it has completely fallen. When something falls, it is physically dropping down and may not be held back up. When I say sag, it's implying that it's still being held. So that's the difference between the two. Mission means to send. Partum means birth. So when I look at a term like postpartum, it means after birth. Phoria. Phoria means feeling. Now here it's tricky because feeling does not mean a nervous sensation. It is referring here to an emotion. How do you feel in the sense of your emotions, not if you have that nervous sensation. Physis means to grow. Plasm means structure or formation. Now once again, not the same. When I'm looking at structure, I'm physically looking at what something is made of. When I'm looking at formation, I'm looking at how it's produced. Just as with the suffixes, there are some corrections that need to be made to the definitions in your textbook for the various prefixes. Those you see listed here. Just as on the previous slide with the suffixes, these are the definitions I want you to know and you will use. Some of these we've already covered, but there are others here that you need to add. So please make sure as you're setting up your note cards, you use the definitions you see here, and these will be the same ones listed in the chapter outline. Now we're going to cover some of the other prefixes that you need to know now, because again, we're going to be using these all semester. And these are missing from the chapter. You will see all of them listed in the outline for this chapter as well as here in this presentation. So make sure you add these prefixes along with their definitions to your note cards. Again, go over these periodically throughout the semester. First of which is ana. Ana means up or apart. Now, you see here once again that conjunction or, meaning you use one or the other but not both. Up is looking more at the idea of direction going in a certain way, whereas apart means away from. So when we look at these two, they're not remotely the same. Now, this is one of the problems students are going to have. If you're defining a term, you have to decide which definition do I use. If I see that prefix ana, do I use the definition up or do I use the definition apart? And that can be rather tricky. Here's what I will do for you during the semester. When you're breaking down and defining a term, and you've got two definitions as you see here, as long as you list them both in that part of defining each component, which is the second step in our three-step process, then I will give you credit. So if you write your final definition and you used up when you should have used apart, or you used apart when you should have used up, I will not take off a point the first time you do that. The reason is because you knew, based on the way you broke it down and defined it, that ana meant up or apart. You just didn't know which definition to use for this particular term. That's understandable to me, and that's part of the learning process. So the first time you make an error, I won't deduct a point as long as you have all of the definitions listed. Because once again, that tells me you knew the definitions, you just didn't know which one to use for this particular term. Now, once I've shown you which one to use, which I will do on any quiz, exam, or report, from that moment, I expect it to be used correctly. So I will allow you to miss it the first time, but from that point, you must get it correct. Auto means self. Kata means down. DE, now this is a little bit of a tricky one, can mean down, away from, or lack of. Now, we will see lack of being used quite a bit this semester. Down and away from occasionally, but not quite as much. Infra, now this is a tricky one because people see that IN and they think it means inside. It does not. Infra means below or under. Mal. Mal means bad. Meta. Meta means beyond or change. Now, once again, these two definitions are not the same. So when will I know to use which one? Well, as we get our experience throughout the semester, that will come. Very often the suffix will tell you which one to use or the combining form, and you'll learn. But once again, if you make a mistake the first time, as long as you have both definitions listed, I won't deduct a point. Neo means new. Para, we've talked about this one a little bit already, which means abnormal or near. Peri, which we've had already, means surrounding. Retro means behind or backward. Now, these two words may seem similar, but they're not. Behind is looking at a location. Backward may be looking at how something is formed. So that's a big difference. Supra means above or upper. Now, again, these two are not the same thing. Above is looking at a direction in the sense of not being with something, but in a direction that is apart from it. Upper is looking at that structure in the highest location. So keep that in mind as you're looking at these. These two words do not mean the same thing. Ultra means beyond or excess. Once again, not the same thing. Because when we look at beyond, it could be directional. When I look at excess, it means an amount.